local people, important issues. CBS 10 WILM's weekly focus on the Lower Cape Fear region. This is Byline Wilmington with your host, Don Ansell.
Welcome and good morning. Well, this morning we're going to talk about some issues that a lot of us are talking about. The debate on national health care, the use of medical marijuana, and we're going to talk about a few issues that maybe aren't being discussed very much, like the advertising of prescription drugs to the public and political pressures being brought on the FDA in the approval process. Our guest for all of this is a local physician. She is a geriatric specialist. It's a pleasure to welcome Dr. Marcia Fretwell to Byline this morning. Thank you for joining us. We've been talking on the phone. Today is my first opportunity to really meet you in person, and we appreciate you coming in this morning. So let's start with the recent 7-hour televised healthcare summit that's gotten a lot of attention, a lot of press in the past couple of weeks. Any comments on that?
Well, I think I look at the sum of that as a demonstration of the possibility of civility and communication within our legislators. And in asking my older patients what are they worried about these days in the world, and it is that inability of individuals in Congress to be able to talk to each other. So I think actually demonstrating in front of everyone that these people still have the capacity to talk to each other that way, and that both sides had reasonable ideas.
So you think it was a productive exercise?
I think it was, probably in an intangible way, though, that a lot of people will say, well, it didn't get the bill. Nothing concrete came out. But, you know, so much has to be done before anything concrete comes out of anything.
So let me get really broad here. You're a physician. How broken is our healthcare system now?
Extraordinarily.
Yeah?
Extraordinarily. I'm a physician whose practice is about 95% Medicare reimbursed.
Because you're a geriatric specialist.
Because I'm a geriatric specialist. I've been doing it for 35 years. And what really concerns me the most is that there's absolutely not 1 cent in the Medicare Trust Fund, that probably 70% of the government will be devoted to health care in the future, and that a majority, or at least a significant proportion, of our deficit is Medicare.
So you think we need major reform?
Absolutely.
And in the best of all worlds, what would you like to see come out of all of this? I know that's
you really want my...
I do.
Okay.
Although, and we can't take the rest of the show, which we could.
But let me just, I'll say something. I've thought a lot about this. I've actually gone to Washington. I've talked to Hagan, I've talked to McIntyre. I'm trying to be a very good citizen about this because it's very relevant both to my business, but it's relevant to older individuals too, because they already have care and it's reimbursed. And it's for sure that if we add care, it's going to have to come out of someplace. And I think Medicare is where it'll come from. My take on it, and I was happy to see that a whole nation had taken this, is I actually think we ought to take the profit out of healthcare insurance.
Do you think your colleagues would agree with you?
Well, I think there are plenty
doctors.
Of people practicing who aren't making huge profits. But what happens, we have several models over time of for-profit coming into an industry. And there's yet to demonstrate there's an improvement in quality or access, but there is an improvement in cost. And the Medicare revenues go up. And I really think I have questions about whether my tax dollars going into the Medicare Trust Fund are actually supposed to end up in the pocket of Wall Street investors.
And you think that's happening?
Absolutely.
So you want the government to take a much more prominent role in the healthcare system in America?
In the financing of it. I don't think the government needs to be delivering the care. I think the government needs to figure a way of controlling costs. And I'm proposing that reducing profits is one way to control costs without introducing rationing, which is the other way.
So you're saying that you want the government to establish rates that can be charged by hospitals, medical professionals, doctors? Is that?
Or maybe just establish the limits of profit taking. And people need to make a living, and it's perfectly reasonable for them to make a good living. I have no objection to that whatsoever. But what I'm talking about is if we have a fixed amount of money to deliver services to people in this country, how much of that money should go to profits and how much of it should go to care?
Do you think that's a viable option for passing legislation? I mean,
well,
you hear the word socialism.
Absolutely. Well, I'm aware of this position I'm taking. But interestingly, just read that both Switzerland and Taiwan in 1994, when they were trying to solve their health care crisis, everybody in 1994 had a health care crisis, by the way. It wasn't just the United States. We were just the ones that failed to act on it. But in 1994, Switzerland, which is a very capitalistic country, made their health insurance go nonprofit. And that's how they chose to solve it. And it's interesting, they say, we're capitalists, but we believe in solidarity. We believe in community. We believe in sharing resources fairly. And so I think it's possible. Certainly Switzerland's very different than the United States.
We were talking about Medicare and legislation that would have cut Medicare fees to doctors by about 21%. Got a reprieve at the 11th hour and didn't happen, but it's been put off into the future. What would the fallout be if fees to doctors are reduced for Medicare patients 21%? What would the fallout be?
Well, even delaying them 10 days for some practices, particularly primary care practices, solo practice, which is what I do, is disastrous. It would put me out of business. No question about it. And the general feeling is that Medicare is right on the verge of not paying enough anyway to support the overheads of health care.
Well, what were they thinking when they passed this proposed legislation would cut doctors' fees by 21% for Medicare?
Well, it was
other
well, like
legislation
10 years
involved.
ago, they linked Medicare reimbursements to doctors to cost of living or some, and so it was hopefully going to be a cost containment maneuver, but because the costs just kept going up and healthcare costs went up out of proportion to other costs in the country, it's led to this 20%. It started at 3% and then 6%, it's just gone up over time. It's another...
Is it dangerous?
Yes,
That's very dangerous
it has to change.
To the whole system.
Yes.
We're going to come back and talk with Dr. Marcia Fretwell, a local physician who specializes in geriatric medicine, about the insurance industry. How much responsibility does the industry bear for the problems we're having right now? We'll come back and talk right after this. Stay with us.